All right. Good morning, everyone. Thank you for joining us for our live webinar for employers with 1 to 50 employees. My name is Darian Brown. I'm your host for today. And today we are going to show you why offering health plans and programs from Blue Cross and Blue Shield of North Carolina is the top choice for your company, your employees, and your families. Before I introduce our presenters, I'd like to cover a few housekeeping items. This webinar is being recorded and will be provided to all registrants after the session. If you have a question anytime throughout the webinar, please feel free to use the Q&A feature. We have a team of experts behind the scenes to answer any questions. There will also be a time at the end for any additional questions. Lastly, at the end of today's session, a survey will automatically pop up in your browser. Your feedback is very important and it helps us create more dynamic and engaging webinars in the future. Plus, by completing the survey, you will be entered into a drawing to win a $25 Amazon gift card. So please keep a lookout for that. To start, we will talk about why our customers and why our customers and our members choose Blue, specifically specifically with the strength of Blue means for you, how we are making healthcare more affordable, how we are giving you the choices and flexibility you and your employees need. We'll show how we're making it easy for you and your employees to get the most of your plan. And lastly, we'll wrap it up with all the value added programs that help keep your employees healthy. That's a lot to cover in our time together. So without further ado, allow me to introduce our speakers. Today, we have Renee Mills and Susan Richards, who are our experts in healthcare insurance, particularly for small businesses. Renee has been with Blue Cross NC for 8 years. She has held positions in management in both new sales and retention, and has worked as an account executive on the new business sales team. With over 18 years of industry experience, both on the carrier and agent side, she brings a high level of expertise and is dedicated to ensuring each Blue Cross NC member has a confident knowledge in their family's insurance coverage. Susan has over 24 years of health insurance experience, including the last 22 years here at Blue Cross NC. For the past 8 years, she has worked directly with small businesses throughout North Carolina, helping them to design their right benefits and services to meet their unique needs. She brings an in-depth understanding of our customers' needs, making sure our clients feel guided and supported in their partnership with us. Working with you both, I know you are very enthusiastic about our evolving industry and working hard to innovate our plans and programs to address these changes. Thank you for joining us here today.
Thank you for having us.
Good morning. Thank you for having us.
Absolutely. Now that you've met our presenters, Renee, I'll turn it over to you.
Thanks, Darian. So, as an employer, have you ever struggled with the hard decision of what insurance coverage to offer your employees that both provide their families the full, easy to understand coverage they need and have long-term price stability? Today, we'll show you how Blue Cross and Blue Shield of North Carolina can put your minds at ease by being that solution for you and your employees. At Blue Cross of North Carolina, it's our mission to deliver smarter, better healthcare for you, your employees, and their families. And we do this by focusing on three things. One, providing a simpler experience. Two, bringing access to higher quality care. And three, making healthcare more affordable. This triple aim is our promise. So you might ask, how are we doing? Well, let's dig into those results. We strive to provide our members and clients with an excellent experience through a plan that is easy, seamless, and dependable. And the proof is in the numbers. In an annual survey of both Blue Cross NC members and non-members, respondents ranked Blue Cross #1 in overall satisfaction, trust, and peace of mind, and prefer us 6 times more than our competitors. And research shows that small businesses rank us number 1 as well, and they rank us in overall satisfaction, preference, and consideration over our competition. Employers say that they are most satisfied with cost, network strength, services, and our programs. This is why our customer retention is at 98% and why more Americans are insured with Blue. Second, access to quality care is key. We are here for all North Carolinians, no matter where they live or where life takes them. Whether your employees are at home or traveling abroad, they can count on Blue Cross for consistent, high quality coverage. In North Carolina, we are proud to offer access to 95% of doctors and 98% of hospitals in all 100 counties of the state, ensuring care is always close by. And with our Blue Premier program, we partner with 100% of the largest health systems in the state to deliver better care and lower costs. Our medical plans include Blue Card, which means coverage travels with you. Nationally, our network spans nearly every zip code in the United States, with access to over 2 million in-network providers, the largest in the country. And globally, our reach extends to nearly 200 countries and territories, so your employees are covered wherever they go. The strength of Blue shows in our provider relationships. And make no mistake, our relationships are strong and stable, which means greater access to care with less disruption for your employees. These relationships are a critical part of offering lower cost and quality care options too. That's why year after year, providers stay in our networks and why you get the best negotiated costs with them. Last, but certainly not least, affordability. It's no secret that healthcare costs are on the rise, and we work to provide greater affordability to both you and your employees in terms of the premiums and medical costs you pay. Managing healthcare costs is critical to providing lower cost of care. As stewards of your healthcare dollar, Blue Cross of North Carolina continues to focus on transforming healthcare through a total cost of care approach. Projected medical inflation is 10.2%, but by the end of 2025, we are expected to reduce that by nearly 6 percentage points through our cost-saving medical and pharmacy solutions. These include pharmacy and formulary management, discounts achieved through network partners and value-based care arrangements, payment integrity services, which alone are generating a $42 per member per month savings, chronic and case management through our nurse support program, and the like. So what does all of this mean for you? It means together, you plus Blue can offer your employees smarter, better healthcare now and into the future. We know price is important. You need to pay your employees and keep the lights on. And providing health benefits to attract and retain the best employees is important too. You need affordable benefits that help take the cost burden off of you and your employees. This map highlights how Blue Cross of North Carolina continues to lead the market in affordability for small groups. In key regions like Asheville, Hickory, and Boone out west, and Greenville and Elizabeth City out east, our premiums are 15 to 17% lower than our competition, making us the most cost-effective option for employers. Even in larger metro areas like Charlotte, Greensboro, and Raleigh, we maintain a strong pricing advantage with premiums 11 to 14% below other carriers. While a few markets show smaller differences, our statewide average still comes in 12% below the competition. That's a powerful message for small businesses looking to manage costs without sacrificing coverage. If your medical insurance isn't with us today, I strongly encourage you to shop it with us. The numbers speak for themselves. We are leading price in every region across the state. At Blue Cross of North Carolina, our approach to pricing is grounded in stability and responsibility. We set our rates to cover claims, not to chase trends. That's why our premiums have remained consistently affordable over time. In the small group market, we've demonstrated this with low single-digit increases and some decreases over the past 6 years. That kind of consistency is rare in today's medical insurance landscape and reflects our longstanding commitment to North Carolina's small businesses. Since 2020, our ACA rates have increased just 13.2% overall, averaging 2.1% per year. In contrast, United Healthcare's rates have risen more than 45% over that same time period, with an average annual increase of 6.4%, including a spike of over 12% in 2022 alone. Our pricing strategy is built around long-term sustainability. We only pursue increases when they're warranted, and we do so with transparency and care. While costs across the industry are rising, our history shows that we act with intention, implementing changes only when necessary and always with our customers' long-term interests in mind. As costs continue to climb, I'd like to discuss what's happening here in North Carolina and how Blue Cross is stepping up to tackle the issue. Healthcare is at a tipping point. We are spending billions, yet outcomes aren't improving, and affordability is slipping further out of reach. Businesses are feeling the strain, and consumers are frustrated, and they're right to be. Last year, North Carolina spent approximately $94.5 billion in healthcare costs. Despite spending that much, North Carolinians aren't getting healthier or spending less. This slide answers a critical question. Where does my premium dollar go? Well, at Blue Cross, we believe in transparency. People deserve to know how their money is spent and why it matters. 87 cents of every premium dollar goes directly to medical care. That's 28 cents for medical professional services, 26 cents for outpatient services, 18 cents for pharmacy costs, and 15 cents for inpatient services. The remaining 13 cents supports operations, 10 cents for customer service and operating expenses, 2 cents for taxes, and just 1 cent for profit. At Blue Cross, we set rates to cover claims, not to maximize profit. That discipline has helped us maintain a strong market position, even as costs rise across the board. And unlike other carriers, we answer to our members, not shareholders. We're investing in tools to help people find affordable care, reducing administrative burdens for providers, and expanding support for complex health needs. This is a hard moment for healthcare in North Carolina, but we are showing up with transparency, urgency, and a commitment to rebuild a system that works for everyone. Now that we've dug into the details of value and pricing, I'm going to turn it over to Susan, who will show how Blue Cross of North Carolina brings a range of options in both plans and programs to meet your company's unique needs.
Thank you, Renee. Those were great pricing insights. As you mentioned, getting affordability right is key for our customers. We also know that providing the right mix of health benefits is important too. Making sure your employees have the right plan choices and flexibility is a balancing act. So let's talk about how we can help. We make it easy. You determine what you want to offer and how you want to fund your plan. Let's start with funding your plan. Most employers have the option to be fully insured or self-funded. When you select a fully insured plan, you pay a set monthly premium, and Blue Cross North Carolina assumes the risk for the plan and processes and pays claims. In a fully funded plan, you gain pricing stability, flexibility, and peace of mind as Blue Cross North Carolina diligently manages costs to ensure your employees receive optimal care. In the local group segment, we also offer balance funding, which is a self-funding option that provides valuable insight into healthcare spending with the potential to receive savings back, all while having predictable monthly premiums like fully insured. This funding type also provides access to a broader plan portfolio for medical and pharmacy and additional flexibility with stop loss levels and settlement options. In addition to funding type, you have a choice of networks. Our largest and most popular network is Blue Options PPO, with 98% of hospitals and 95% of doctors in North Carolina in this network. Choose this option if you want your employees to have our largest network of hospitals and doctors. If you want to offer your employees a network that provides savings without sacrificing quality, consider our high performance network. This carefully curated EPO network offers a high quality provider network with greater care coordination and savings. Our networks can be offered with any of our medical plans. Our plans offer a wide spectrum of options ranging from all copay plans to deductible and co-insurance options. Let's spend some time reviewing each of the plan types. Traditional copay. This is a traditional plan design with copayments for primary care, specialist, urgent care, and emergency room with deductible and co-insurance for in and outpatient services. Deductible and co-insurance is a plan design where members will pay their deductible and co-insurance for services. Members can still receive mandated preventative care services covered at 100%. Our Blue 123 plan offers coverage levels that vary based on place of service and provider type. Primary care and preventative care at level 1, inpatient care at level 2, and outpatient and specialty care at level 3. Some services are provided with a copayment, while others apply to deductible and co-insurance. This plan type currently available only through our self-funded plan options. All copay is a plan designed to take the guesswork out of benefits. This is the only plan type that has no deductible or co-insurance, and you receive copays for your in-network services. This plan is easy to explain, and members can feel confident about understanding their benefits. You may also want to consider offering savings accounts to help your employees pay for medical or dependent care expenses using tax-free dollars. There are 5 types of savings accounts available, all fully integrated with your health plan and offered at no cost to you. Last but not least, employees want dental and vision benefits. And at Blue Cross North Carolina, you can integrate them with your plan benefits for a seamless experience. You may want to consider our full range of ancillary plans, so we'll review more on this later. Now, finally, you have the flexibility to offer up to 4 medical plan options, giving your employees the freedom to choose coverage that best fits their needs and their families. With a wide range of plans and benefits, it's easy to build a package that works for everyone. Now let's take a closer look at a few of these options. Hopefully everyone is now familiar with our popular Blue Options PPO network. But if your company and employees are located in the colored counties on your screen, the Blue High Performance Network may be right for you. Our Blue HPN is a carefully curated network of high-quality hospitals and doctors who consistently deliver higher quality care at lower cost. This translates into lower premiums and cost of care for members. Compared to our Blue Options network, the average premium savings continue to be significant, with ranges from 16 to nearly 20%. We have strong anchor systems with Atrium Health, Duke Health, Iredell Health, and Fry Regional. Blue HPN is available across 28 counties, including York County, South Carolina, and coverage spans nationally across more than 65 major U.S. markets. Blue HPN is a combination of a great statewide network and a solid national network. Members have coverage from these network providers, as well as coverage for urgent and emergency care when outside of the network. Balance funding is an alternative option for those who want the savings of a self-funded plan with predictable monthly payments of a fully insured plan. Balance funding offers integrated stop-loss coverage, making it a great option for employers who are interested in a self-funded plan but want to avoid the financial impact of large claims. The set monthly payments include administrative and stop-loss fees, as well as reserves, so there's no additional claims liability upon termination. Plus, when actual claims are less than projected, employers may receive a portion of the surplus. Another benefit of balance funding is monthly reporting, which shows how your healthcare dollars are being spent. This information can help you understand the relationship between benefits and cost, identify opportunities for saving money, and help you make smarter healthcare decisions. Balance funding is currently available to employers with a minimum of 12 employees and a minimum of 5 enrolled. In addition to our medical plans, for those employers with 1 to 50 employees on a fully insured plan, we offer a total health bundling credit of up to $10.50 for medical enrolled employees monthly when you bundle your Dental Blue, Blue 2020, and employer-funded life, short-term disability, and long-term disability with one of our Mosaic partners. For a 45 life employer, that is over $5,000 annually in premium credits. And as an added bonus, your medical, dental, and vision can be on the same ID card and maintenance system. Our broad carrier selection offers you the advantage of finding the right benefits for your company. When you purchase your life and disability plans through Mosaic Group, we shop these carriers for the company that offers the best solution for your company. Now that we've explored plan types, networks, additional benefits like ancillary coverage and savings accounts, let's turn our attention to how easy it is to set up and manage these benefits. Here are some of the tools and resources we provide designed to streamline administrative tasks and help make offering and using benefits easier for both you and your employees. You can easily be quoted with no obligation and enrolled the same day. We offer plans starting on the 1st of each month. When enrollment is submitted by 6 p.m., your account is fully set up and a welcome email with your account number goes out the next morning. If you purchase your medical, dental, and vision on the same effective date and group number, you'll only have one maintenance system and ID card. You'll find virtual open enrollment materials are available to help educate your employees on their selected benefits. We provide electronic ID cards to brokers, group administrators, and members through their online portals and mobile app. Our Blue Connect mobile app provides the same features as our full online member portal, so your employees have easy access to everything they need on the go. Once your benefit plans are enrolled, you will receive detailed information about the employer portal. This portal has everything you need to manage your company's benefit plans, from adding and removing employees in real time to viewing and paying your bill. This online employer portal is easy to navigate and gives quick access to the things you need 24/7. And don't worry, when you need us, we are always just a phone call away. Our Employer Services Contact Center is your dedicated resource when you have questions on managing your account and online portal support. And finally, encouraging your employees to sign up for their Blue Connect account will give them resources at their fingertips to make the most of their plan benefits. They can find in-network doctors, check medications, view claim and benefit details, chat with our service team, access their ID card, and even download it to a digital wallet. Now I'm going to turn it back over to Renee to share information on our healthcare programs.
Thanks, Susan. Price and the logistics of how your plans work are of utmost importance. But let's not forget about all the additional programs and services that come built in to your plans at no additional cost. These programs assist in both getting your employees healthier, keeping them healthy, and driving down their day-to-day cost for medical and pharmacy services. And on the next slide, you'll be able to see there are a lot of programs built into our health plans to help keep your members healthy and get the most value from their plan. From clinical support, virtual care, pharmacy programs, and wellness support. Member engagement in these programs is important for better health. To assist with that engagement, we have promotional materials for employers, such as toolkits and monthly webinars, and we communicate with members directly via email, text messaging, and mailed letters to inform and incent members to use these programs when appropriate. Let's dig into an example of how some of the programs we offer may assist a Blue Cross NC member. Meet Lenora. She's 39 and dealing with financial problems that have forced her family to downsize and move into a new area. She's under high stress, has trouble sleeping, and lacks energy. She's prone to bouts of anger that are negatively affecting her relationships at home as well as at work. Her anxiety medication has run out and her refill prescription has expired. Here's what Blue can do to support this healthcare journey. Access to mental health care is a systematic challenge. It's vital that members experiencing a behavioral health event get the help they need quickly and avoid costly, time-consuming ER visits. Lenora did not have a regular doctor or psychologist in her new hometown yet, but luckily, our on-demand service connected her with a behavioral health provider virtually that same day to get a short-term refill of her anxiety medication. The appointment also helped her see that she needed regular therapy sessions to help her stabilize her long-term emotional health. After avoiding a medication crisis, Lenora turned to finding a therapist in her area, ideally a female provider to make her more comfortable. Blue Cross of North Carolina's Care Navigation program provided 3 in-network options that met her preferences and were located within minutes of her home. She began working with a therapist on emotional triggers and medications, which helped her alleviate strained relationships with her family and coworkers. As ongoing therapy helped her regain motivation, she took advantage of our standard nutrition counseling benefit, This benefit covers up to 30 visits as preventive care and is covered at 100%. This helped Lenora reduce stress eating to reach a healthier weight and improve her energy level. Forming healthy habits will help Lenora thrive for decades to come. Now that she's eating healthier and regained more energy, she's primed to begin a walking program through our wellness engagement platform. Tracking her steps on her mobile phone is easy, and she stays motivated to reach her goals month after month. The chance to earn rewards for completing activities gives Lenora an added boost in the early stages, and by focusing on small, achievable actions, Lenora paves the way for long term behavioral health change without additional stress. So, as you can see, with built in programs that support real change, like Lenora's journey, it's not just about finding a plan that's affordable, but a plan that is impactful. We hope that you see how Blue Cross of North Carolina, we're more than just a health plan. We are a trusted partner that empowers your business, supports your employees, and delivers value every step of the way. I'll now turn it back to Darian to close us out.
Thanks, Renee. Alrighty. So be sure to talk with your agent about the best options for your company. And remember, you can get coverage the first of any month. So be sure to speak with your agent today. Or if you don't have an agent, you can visit our website to get a free quote. And now we will open up. Oh, I'm not even there. And now we will open up for some questions. Let's see. So the first one, can you hit on trends with the data points on the 1 to 50 market?
Sure, I'm happy to take that one. So for 2025, we don't have a full year of trends yet. The data is still up in the air for the remaining portion of the year. However, thus far in 2025, we're seeing a consistent numbers with what we saw in 2024. And in 2024, our trend for small group was 3.8%.
Awesome. Thank you, Renee. We've got another question. How much lower are employer premiums compared to individually purchased insurance?
Thank you, Darren. I'll take that one. So there's two components to this question. One is just base rate comparison, and then the other aspect is just actual premium costs to employees and members. Since employers typically contribute to the cost of insurance for their employees, and sometimes their family members, the actual cost of that employee can vary. In the individual market, the rates can adjust based on qualifications for tax subsidies. Overall, employers like to purchase employee benefits, not only for flexibility of plan choices and pricing, but also for employee retention. Our upcoming 2026 rates are still pending approvals. Those rates typically go into the market around mid to late October to start 2026 comparisons.
Thanks, Susan. Another question. Do you expect group sales to jump if the big, beautiful bill drives up the the individual medical subsidies?
Yeah, I'll take this one, Darian. So the expiration of subsidies is definitely a concern. We do see that making an impact just across the board in general. However, we're committed to customers and helping them find the most affordable care and the best coverage for them. Obviously based on eligibility. So some of those individuals may qualify for a group plan, some may not. It will depend on the setup of their group. I will add that we have a number of companies in North Carolina that currently don't offer medical coverage in that small group market because they're not an applicable large employer, so they're not required to offer it. And a lot of them have been hesitant to do so because their employees are currently receiving subsidies and they didn't want to take that away from them. But with this change, I do believe that we will see a lot of those employers looking to offer coverage maybe for the first time for their employees. So I say lean on us to help you with those decisions. If you're currently working with an agent, have those conversations with them so that we can assist in finding the best coverage, what works for your company, and let us take a look and shop it.
Awesome. Thank you so much, Renee. So we do have a few other questions. Let's see. We have 5 employees, and what plan can you suggest for us? Either Renee or Susan.
Yeah, I'd say with just 5, you're not going to be eligible for our balance funding product yet. That does require a minimum of 12 eligibles with a minimum of 5 enrolled. So initially, the ACA coverage is what you would be looking at as an employer. We also have a cool new product coming. Early next year that you'll get some news on soon that may also be an option for you. So just keep your ears and eyes open for that.
Awesome. Let's see. Does Blue Cross NC offer low cost coverage for all inclusive, meaning medical, vision, and dental?
Thanks, Darian. I'll take that one. Employers can offer medical, dental, and vision plans in any combination to suit their specific needs. When bundled together on a fully insured plan, you receive that one account number, same coverage date, and one ID card. But you also can receive the administrative credits through the total health bundling that we talked about earlier in the presentation. And those are applied directly to your bill.
Awesome. Thank you, Susan. We're getting a few questions in here, so give me just a moment. All right. Is there any update for EDI feeds for under 50 lives? Do you have plans for sole proprietors?
Okay, I'll break that up. As sole proprietors, I know I saw another question on that one, so I'll let Susan jump on that one. But EDI feeds for small group, that's always a burning question, especially from our agent partners. So we do have plans that will plans to roll out something soon. It's actually in testing phases right now with a number of our agencies. I wouldn't call it an exact EDI feed the way that we have for 51 plus, but it does allow bulk updates for maintenance, whether that be adds, terms, and changes. And it can be done by more than one group at a time. So, for example, if an agent is making maintenance changes for 3 groups at one time, we allow an update or upload for them to do that simultaneously. So, as an employer, rest assured that we do have something coming that will make that maintenance more seamless, a little bit easier. I know a lot of you work with agents that have been admin systems, and you're making those changes in those systems. Currently, that's not feeding over directly to us. But with this update, again, it's in testing phase right now. That will be coming, and I'll say we are big on testing because when we fully roll something out, we want to make sure that it works the way we would like it to work and we don't have any hiccups. So testing's going well right now, and we do hope to roll it out soon.
Great. And I think the other question, Darian, was I am the sole employee at my company and wanted to know about eligibility for medical coverage. So yes, we do offer coverage down to 1 employee. However, self-employed individuals or sole proprietors and spouses filing business income on a Schedule C, E, or F will need a common law employee to be eligible. So you would definitely want to talk to your authorized agent, or you can use the online quoting tool for additional eligibility on that and more information.
Awesome. Thank you so much, Susan. That is all the questions we are going to have time for today. We will follow up directly with any outstanding questions that we haven't answered. And please don't forget to complete your survey for a chance to win the free $25 Amazon gift card. Thank you all so much for attending. Have a great